Welcome everyone to Healthy Happy Hour. I am Joseph Ward and I'm joined by the incredible Mr. Ian Costello. What's going on, Ian? How you doing today, my brother?
Man, usually I'm in the background, but you got me on Front Street today now.
You got to come by and show your face sometime. So everybody, this is the
Funny.
man behind the plan that make everything happen. So y'all give him a round of applause on your end, that virtual round of applause. So this is Neighborhood Medical Center, and this is our Healthy Happy Hour. Healthy Happy Hour is an event that we hold every third Thursday of every month, and we like to connect our community with the resources that are available within our community. It's a free event. If it's no COVID, we will be face to face and we will feed you. We can't do that right now, so we decided that we still want to keep our Healthy Happy Hours going, so we brought it to the virtual space, and we're going to keep that going as long as possible. Hopefully we get to go back to some type of regular life sometime soon, so hopefully, but until then we're going to make sure we continue to give you the information that you need. We also want to let you know that Neighborhood Medical Center, we have our podcast, which is called Mind Your Body and Soul. And Mind Your Body and Soul is available every Wednesday on our website, nmcpodcast.com, or our Neighborhood Medical Center YouTube channel, or Anchor, Breaker, Radio Public, Pocket Cast, Spotify, or Google Podcasts. So once again, nmcpodcast.com is the website. And you could also go to YouTube in Neighborhood Medical Center and you could find us. All right, so today's Healthy Happy Hour, we have a gentleman named Mr. Tim Bowman who is representing WellCare, and he's going to come on and give us a general overview about WellCare and how different ways healthcare plans can be accessed and how he can help you access the healthcare plans. So how you doing, Mr. Bowman? Welcome to Healthy Happy Hour.
Well, thank you, Mr. Ward. I'm doing great, and I hope that you and your staff, as well as everyone who's tuned in, is doing great as well.
Yes,
it's a pleasure to be here today to talk about, health plans and issues regarding health. I mean, that's pretty much a hot topic right now, especially being that we're in a pandemic.
Right.
And individuals are always concerned about health-related issues. So I'm glad to be here to talk to you as well as your listening audience. It's a privilege and a pleasure to be here. As you just stated, my name is Timothy Bowman, and I work with WellCare Health Plans, and I work as a Medicare advisor. And my duties and responsibilities, I'm going to give you an overview, but not limited to. But what I do is I assist individuals who are Medicare beneficiaries with the enrollment into health plans. And the majority of the health plans we're advertising right now and marketing are Medicare Advantage plans.
Okay.
And these are plans that offer individuals who are on Medicare and or Medicaid additional benefits beyond original Medicare. Original Medicare covers Part A and Part B, which is hospitalization, and that's Part A, and Part B is doctor visits and outpatient care. Well, individuals who are on Medicare, they have other needs beyond going to the hospital and going to doctors. They need dentists, they have eye issues, they need vision, and they also need hearing related support and benefits. So that's where we come in as a private health insurance or health plan company. We come in to provide these additional benefits to individuals who need them, who qualify for them, and they are not receiving them through original Medicare.
Okay.
Now, to qualify for these health plans, the only requirement is that you have to be on Medicare.
Mm-hmm.
You have to be on Medicare. And what qualifies you to be on Medicare? Number one, you have to be 65 or older, or you can be 65 and younger and disabled according to the guidelines of CMS or Social Security Administration defining which disability the individual will qualify for Medicare.
Right.
And also if an individual has end-stage renal disease, that means that they're on dialysis. So those three categories, individuals could qualify, will qualify for Medicare. And that means that they will be eligible to enroll into one of our health plans. Now, an individual can also have both Medicare and Medicaid and enroll into one of our health plans as well. And those individuals are in a special category, or a category that they could receive additional benefits beyond the regular benefits that a person that only had Medicare receives.
Right.
Those individuals are considered dual eligible because they have both Medicare and Medicaid. Therefore, the types of benefits and the level of benefits that they will receive because they're dual eligible will be much higher than the individual who had only just Medicare.
Okay.
Yes. So we, before the pandemic, our company, we partnership with a lot of medical centers like I partner with your location,
right,
as well as doctor offices, nonprofit organizations. We go to food banks. We go where there's heavy traffic areas, but also there is an economic area that needs these benefits the most.
Right.
Yes. So we try to target, areas, not necessarily people, but areas where there's, a lot of foot traffic. We also have relations with different pharmacies around town in different counties, as well as large grocery stores and things like that, as well as convenience stores.
Mm-hmm.
But we try to get the information out as best as we can to individuals to let them know that they're leaving a lot of benefits on the table, that these benefits are at no cost to them, first of all. Most of these plans that we're advertising to the population, they have a 0 monthly premium,
okay,
and a 0 deductible. So this is not about them coming up with money to receive the benefits or enroll into the plan. They already qualify, because being on Medicare, it means that, first of all, to receive Medicare, you have to have worked at least 10 years and paid into that system,
okay,
or 10 years or 40 quarters to receive Medicare.
okay.
So we're offering these benefits, and most people say, I can't believe you're offering something for nothing. I mean, how is it that your company can offer dental, vision, hearing, over-the-counter supplies and things like that at no additional cost? And, we always tell them that, over time, you've already paid into the Medicare system if you work at least 10 years and they've taken that out of your check. So you actually have already made an investment into Medicare.
Right.
Yes, sir. So I'm here for any questions that your listening audience might have. Keep in mind that it's an informal meeting for me, because I can't go into details about plans because of HIPAA, and also, personal health information acts and personal information. We can't disclose that when there's so many other individuals are on this call.
Right.
But I'll be more than happy to. Excuse me, sir. Go right ahead.
No, I was gonna, because my mindset is more so toward access, because our patients and the communities that we serve,
yes, sir,
accessing healthcare or accessing healthcare plans, for some of them, they usually run into roadblocks, or they don't even know where to start. So let's say you have somebody who 18, 19, new in the world, need health care, need a healthcare plan, don't know where to start. How would WellCare be able to help them get to where they need to be, as far as from step 1 to step 2 to step 3?
Okay, now you said you're talking about a younger population, correct?
Well, either a younger population, or just somebody, period, who is interested but don't necessarily know where to start.
Okay, now keep in mind that, we're servicing individuals 65 and older.
Okay.
or
Okay.
65 and younger if they're disabled,
Okay. 65.
or yes, or younger if they're disabled, or
Okay.
individuals who have end-stage renal disease. Now, a person could be on dialysis and be 18 years old.
Right.
Okay, so take for instance, you mentioned an individual like that. You know, we do a lot of advertising. You know, we got TV ads, I'm sure we got radio ads, we got information on the web, but we also have individuals like myself who are out in the public, and we're making contact with different areas of town and areas, stores and nonprofits. So we're getting the information out.
Right.
How would that individual actually know how to contact us? Um, you know, we're trying our best to reach everybody. You know, we're trying our best through word of mouth, through advertising, through, you know, when we were out in the field, we would set up event tables to pass out information,
Right.
and you know, try to connect with people that way. So it takes all of these marketing methods to reach the population. One method is not going to reach everybody.
Right.
You know,
Right.
you can be running millions and millions of dollars advertising on the television, but what if a person don't watch TV?
Exactly.
One
Yes,
of the
sir.
things you touched
So
on earlier was the people that's dual qualified for Medicare and Medicaid. I know both of those terms sound alike as far as the care and the CAID. Could you just do just a brief difference of what are the two? Because, you know, one person hears one word and they think that's the same thing.
Yeah.
But obviously it's a big difference between the Medicare and the Medicaid.
yes, sir. Yes, sir. Now I'll go with Medicare. As I was stating earlier, Medicare is federally funded by the federal government, and it is for individuals in specific age class or specific individuals that got a certain medical need. So, as I stated, number one, the class of individuals for Medicare will be 65 and older, or 65 and younger if they have a particular disability.
Mm-hmm.
And let me just finish this statement.
Gotcha.
Okay.
Yeah.
Now, the third category would be the individuals that's on dialysis with end-stage renal disease. So that encompasses most of the individuals that's going to be on Medicare. Now, you go to the other side and you say Medicaid.
Mm-hmm.
Now, Medicaid is not the criteria for Medicaid is not about age.
Mm-hmm.
It's about income.
Mm-hmm.
So the guidelines for determining if you qualify for Medicaid has to do with the income, and they have income guidelines, and also household size.
Mm-hmm.
Yes, sir. So that will determine if an individual qualifies for Medicaid is the income and household size. It has nothing to do with whether a person is 65 and older, is 65. That's dealing with Medicare. So Medicaid is strictly about income and household size.
Okay. It's just, you know, you hear those terms, they sound very similar. So
Yes,
people
sir.
think, you know, like he said, he 18, I want Medicare, and not
Right.
realizing you need to be on the CAID side, not the care side.
That's right. Unless he's disabled.
Right.
Unless
Okay.
he's disabled.
Right.
Now you're absolutely right. Most people, they use those two terms interchangeably,
Yes.
thinking, you know, one is, you know, I can say, you know, but that's where we come in. We have to. A good thing about this job, and the thing I like about it is not just, you know, trying to show people how to get into a health plan, but educating them so they will know, they will be empowered with information about healthcare. So if they come across somebody else that's using these terms interchangeably, they can tell them, no, that's Medicare and this is Medicaid. So I like the educational aspect of this job.
Right.
And I know you spoke earlier about, you know, far as for Medicare, is
Yes,
the
sir.
age, and then also for disability. Joe and also myself, we work with a lot of HIV patients.
Yes, sir.
I understand HIV sometimes can be considered a disability, but really it's not. It's an infectious disease, obviously.
Yes,
But
sir.
people that do have HIV, will they be? I guess they'll be more of the Medicaid as far as their income, or would that be considered disability for Medicare?
Now, that's really a question for Social Security Administration. They make the determination of I'm sure you know that individuals can be at certain levels within that disease where something might be chronic or terminal, and then another individual might have, I don't know if you want to say mild symptoms of it, but they could be infected, but it's not full blown or at a terminal state. So I think Social Security Administration, they probably look at where this individual is and how much managed care this individual need right now and will need in the future. So that will make the determining factor of whether that individual, even though that person is younger, that individual might qualify for Medicare. If Social Security Administration say this person is disabled to a point that this person probably cannot hold down a 9 to 5 job every day, standing on their feet, doing whatever, they're not in the working class. So that individual might be, put on Medicare. And another individual, let's say he's healthy, he's not, if you look at the end of he or she, I'll say he or she looks healthy, they're able to work, but they still have this disease, and say their income is low, and they meet the qualifications of Medicaid, so they could be approved for Medicaid.
Definitely.
I think it's really based on a case-by-case basis.
Definitely.
Yes, sir.
So I want to ask, because earlier you talked about you doing when I link up with a client, you can do one-on-one sessions with them to kind of help them get enrolled or give them more information.
Yes, sir.
Can you kind of give a overview of of some of the things you may cover, how that process may work when you sit down one-on-one with that client?
Yes, sir. Yes, sir. When I sit down with a client, first of all, I want to let them know that, I'm here to help. First of all, I'm here to assist them. So the conversation is very light in the beginning. And I'm just going to let them know that, I'm here to assist you to get benefits that are due to you at no additional cost. And these are available to you if you decide to receive them. But I'm going to let them know that they are eligible to receive them.
Mm-hmm.
Now, the end goal for what I'm trying to do is number one, establish rapport with the beneficiary, and number two, to educate. But number three, I'm doing a need analysis. I'm trying to find out what their needs are so that we can see if our health plans will meet or exceed the needs that they have.
Okay.
So when I meet with them, it's light conversation. Hey, how you doing? How's things going? How's your family? And then the conversation goes into a little bit more about, what they're seeking, what they have right now, what issues that they might have either with their medications, with the doctor. They want to change doctors. They need dental, they need vision, they need hearing aids, they need to save money on over-the-counter supplies. That's where all that need analysis of gathering information so that I can help direct them to the plan that will be best suited for them and their situation.
Okay. So my follow-up to that,
yes,
say
sir.
You have a client who, as far as they may have the disabilities, they may have things that line up where they can access WellCare.
Yes, sir.
What are some things that would disqualify a person from being able to access the healthcare plans that WellCare has?
What would disqualify them?
Yes. Let's say let's use the example of the 18-year-old on dialysis. And so let's say that person has that particular thing going on, and where we know they could qualify for WellCare, but would they be anything that people would need to know ahead of time, or different healthcare plans, or different things in their background that could disqualify them from being able to access the healthcare plans?
Okay. The only thing that we look for qualifications is they have to have that red, white, and blue Medicare card.
Okay.
If they have that card, that means they are eligible for any of the plans that we are advertising in that particular county or area that we're advertising plans. Now, as far as individuals who will go to our site, to look over the plans and things like that, they're welcome to do that. But we have, I have my own personal website where they can go and actually do the enrollment themselves, but they will not be able to complete enrollment into one of our health plans if they are not on Medicare. That is the criteria that everyone who enrolls into one of these health plans, they have to be on Medicare.
Right.
Yes, sir.
Okay.
So once we do the process, I meet with you, we do a needs assessment, we pick a plan. I'm on the plan, and then when I realize this is not the plan for me, I'm in the wrong car, I need to get out now and get in a different car. What would be the process? I know most time you got to wait for open enrollment again. But is there any way where we can help to get them into a different plan before open enrollment, or what happens once they realize that this plan really is not for me and I need to be in a different plan?
Right. You're talking about doing a disenrollment. Now, when an individual enroll into a plan and they decide that they want to, disenroll from the plan and choose a different plan, or they might decide that they don't want to be in any plan. They want to be back on original Medicare and receive their services with the red, white, and blue Medicare card. Now, you're absolutely right. You can't change plans any time of the year. There are periods when you can and when you cannot. Now, we do majority of our enrollments and changes when we have our AEP, which is our annual enrollment period, and that's from October 15th to December 7th. After that period, starting December the 8th, we're in what we call a closed period from December 8th to December 31st. And the only way you can make a change then, you have to have a special election reason to make any changes. Now, those special election reasons are guidelines by CMS, which is the Center of Medicare and Medicaid Services. They establish the rules of when a person can and cannot make changes, and they set the guidelines for those reasons. So if an individual say, well, I don't like the plan and I just want to change, and this is my reason, if that reason meets CMS guidelines, we will be able to assist them with a disenrollment or a plan change. Now, individuals in our open enrollment period, we started January 1st of this year, and it goes to March 31st of this year. Individuals who are enrolled into a Medicare Advantage plan, they can change their plans between this period of time. Say if they wanted to change, they can change from a Medicare Advantage plan to another Medicare Advantage plan, which would be like a plan change, or they can come out of the plan that they're in and back on original Medicare, which would be a complete disenrollment from the plan to original Medicare. But that's the time period when they can change. Now, after the 31st of March, we go back into that special election all the way into October. So the only way they will be able to change again between April 1st and going all the way to October 15th, they would have to have a special election reason that meets CMS guidelines.
Okay.
Good to know.
Yeah, right.
Yes, sir. Yes, sir. Yes, sir.
we have a lot of clients who may not have access to online capabilities, because earlier you were saying some people can go to the websites, and I know because of COVID things have changed. So,
Absolutely.
so kind of a two-parter with this within COVID.
Yes, sir.
Are you all still doing face-to-face meetings with clients during COVID? And if a person, well, I'm gonna ask that first. Are you all, let's say I don't have internet and I need to meet you face-to-face, how is that set up right now with WellCare?
Well, we can do Zoom meetings, but I personally, some individuals are allowed, if they want to go out into the field, they can, but the majority of the force, my teammates, we are working from home, so we're doing everything telephonically and electronically. So even if the individuals say, well, I don't know anything about computers, majority of the people I meet and enroll are in that class. They don't want it. They don't have no computer, well, very little computer knowledge,
right?
Very little internet access or internet experience. So that's where I come in. I can actually talk to them over the phone, explain everything in detail, answer all their questions, all their concerns, any issues. It's a little drawn out, but we cover everything. So at the end, an individual will be at peace about the fact that they are making an informed decision that's best for them.
Okay, good.
Yes.
And I wanted to ask that because, like I said, a lot of the clients that we deal with,
yes, sir,
just trying to do telehealth services sometimes could be a headache just over the phone. So I know it could be a headache with internet. So also this, does having COVID or contracting COVID, will that compromise any of the healthcare plans that a person will have with WellCare?
If they had COVID?
If they contracting COVID.
You say, would that do it? What with the health plans?
Will it compromise anything with the healthcare plans that they are receiving from WellCare, contracting COVID, or will that be seen as something like the flu or a different healthcare issue?
Well, no, it wouldn't affect the plan. They would still be on the doctor's care, and they would still, be covered. Like I said, the majority of these plans have a prescription drug plan that's built into the health plan. Okay. So they will continue as they're going. They would see their primary care doctor. They would see all the specialists that the primary care doctor will refer them to. They would still be covered under prescription drug plan and all and any other needs that they may have, whether it's x-rays, diagnostic exams or blood work or whatever, lab work, all of that is built into the plan. So they will just continue to receive those benefits that they are receiving now, even though that they've been diagnosed with the COVID virus.
Okay.
All right. Sir.
Like I know earlier you said that you've been working from home lately.
Yes, sir.
With me being on the IT side, what is just some of just a few of the benefits and the difficulty working from home and not being able to have that face-to-face interaction that you come across, that you think that you feel like, some of the benefits and also some of the downfalls in working from home and trying to get in contact with people and get them what they need?
Yes, sir. Good question. And well, another good question. Both of you guys coming up with some great questions today. That's wonderful. Well, personally speaking, working from home is
different.
I think, it's different, and it can be challenging. Ain't no question about that, because when I was out in the field, I had when a person is in front of you, you have an opportunity to look at their body language, their tone of voice, and you can pick up on certain clues and you can react to those clues. But when you're talking on the telephone, you're not able to pick up any body language or cues or whatever. So now you're going to have to make adjustments. And being on the phone is all about making adjustments. But I guess pros and cons. Let's see I go with the pros first of all. In this environment, safety for sure. Being that you're at home. I guess another pro. A pro might be actually get a chance to maybe go over more information over the telephone for those who will make the time or whatever. I personally miss being in front of someone talking to them. I really do, because that gives me an opportunity to really be able to see that person, see that body language, overcome objections, and just really, really build a relationship. And see, it's hard to build a relationship over the telephone when the person is not in front of you. I mean, you can you try your best with what you have, but another pro I would say is just the fact that building relationships is much easier, at least for most of us, when we meet people in person as opposed to over the telephone. There is, when you say con, a con is the telephone and the internet is a little bit less. Well, it's less hands-on, but it's less personable as when you're in person and you're able to shake hands and do a lot of things when you're in person. But being that this is the environment we're in, we're the telephone, it's constantly making adjustments, because now instead of body language, the thing that you have to feed off now is speech.
Yeah.
Volume, rate of speech, and you got to make adjustments to them. They don't have to adjust to you.
Right.
You have to adjust all this to them, so you're not speaking too fast. You're not giving them too much information. Then they say, well, what you say? Can you go over that? You gotta slow down, and then sometimes increase. So it's almost like constant adjusting when you're home. It's constantly adjusting. I can talk to some people in the morning, and they don't want to talk before 12 o'clock. They want me to call them back after 4.
Right.
So it's a balancing act. I mean, when you're doing this kind of work from home, but you really, really have to be willing to adjust and be patient with people. Now, this is definitely a time to be patient with people over the telephone, because you got to remember, not only we're all in this healthcare circle. Not only are they dealing with, say, their personal health challenges, but now we're in a pandemic on top of that. And they might be going through economic and financial challenges, might be going through relational issues. All of this is stacked on that. And then with this COVID on top of everything, this is overwhelming to some people. So this is the time, as people who are working in healthcare, that we really, really, really have to be patient with the people that we talk to, because they're under a lot of stress right now. They might not express it to you on every call that you make to them, but trust me, when you already got health challenges, and then on top of that, this virus is no joke. Right. This virus is no joke. So hopefully, with all that I said, hopefully I covered the pros and cons.
Yes.
Definitely.
You did an excellent job. And for me, the greatest thing about it is you enjoy what you do. We can see the passion in what you do coming out of you. And from one fellow community worker to the next, I I thank you. I'm a Tallahassean. I'm from here. This is my city, and
Yes, sir.
I'm always ecstatic about people who truly care about the community members.
Yes, sir. Yes, sir.
And it's more than just a job to you. So I appreciate that from you, that you bring that to work every day, because I know the people who come in contact with you, they they're better because they have access to resources that they may not have had before. And not just that, but you gave them an experience that they enjoyed. So they will go on to tell other people about it so they can get access to. So thank you.
Well, thank you, sir. I really appreciate that, and I'm humbled by your words.
No problem. No
If
problem.
can you give us, I guess, your contact information or ways that people can get in contact with you, so hopefully they can get some of these good services that you're
Right.
offering out into the community and pass it on to others.
Absolutely. Again, my name is Timothy. That's T as in Tom, IMOTHY. Last name is Bowman. It's spelled B as in Bravo, OWMAN. And my direct business cell number is 850-408-9127. That's 850-408-9127. And our web address is www.WellCare. That's one word, WELLCARE.com.
Okay. All right.
And if you were interested in going to my personal website, contact me and I'll give you that information as well.
Cool. Now I really enjoyed this. I wish the internet would start acting better earlier. But no, I
Yes,
definitely
sir.
enjoyed this because, like I say, just being able to learn more about WellCare, learn more about healthcare, just learn more about the systems, but being able to connect people to resources like yourself it's something I enjoy doing. So I definitely want to stay in contact with you so we can work more in the future, because I would definitely would like to be able to see how we could connect for some of the future events that we will have coming up. And
Yes, sir.
of course, we'll keep it as safe as possible. But yeah, we definitely need to work together more in the future, because what you have and what we have, it just goes together. And we've already worked in the past, so just continue moving forward with that.
Yes, sir. Yes, sir. I appreciate that. And my sentiments about what you and N are doing, passion that I hear in both your voice and his voice, and everything that the leadership at Neighborhood Medical Center is doing right now. You know, I applaud you all for the work that you're doing, knowing that there is greater work to be done. And I look forward to partnering with you and your organization to do great things for our community.
Yes,
I know you guys have a passion. I have a passion too. The only thing we need to do is just go out there into the fields and make it happen.
yes, sir. Yes, sir. So I appreciate you coming on, and we would definitely be speaking with you soon, Mr. Bowman.
Absolutely. It's been a pleasure and an honor. And thank you so much for inviting me to your podcast. It's been a pleasure, and I look forward to coming back soon. Hopefully next time
Yes,
I'll be
sir.
bringing my manager with me.
Yes, sir. Let's make that happen.
Yes, sir. It's been a pleasure.